I'm Katie, and this is Homer.
I'm Charlotte, and this is Finn, and today we're going to be talking about ringworm.
When thinking of ringworm, it can easily be confused and classed with the categories of hookworms, roundworms, and tapeworms. However, ringworm is actually a fungus and not caused by a worm infection. The scientific name for ringworm is dermatophytosis. Ringworm is a very common thing to see in practice, more so in cats than in dogs. But it can affect every domestic species, including livestock, horses, and humans. It is also important to note that infections are usually seen on kittens, puppies, geriatrics, and immunocompromised animals.
The fungus causes round, raised, red rings on the outermost layer of the skin and hair follicles, and occasionally infects the nails too. Alopecia can be seen on patients as well. It is not known to be pruritic, but crusting and scaling can be present. The infections are usually superficial and affect certain areas of the body, like the head, around the eyes, ears, and legs. There are 3 common fungal species of ringworm, which include Microsporum canis, Microsporum gypsum, and Trichophyton mentagrophytes. Around 70% of cases we see in clinic are Microsporum canis, which is important to know because this is the only dermatophyte that will fluoresce under a Witz lamp around 50% of the time.
Animals can also be asymptomatic carriers, which means they carry the ringworm fungi on their fur or skin without showing any symptoms. These animals can still spread it to others without showing obvious signs themselves. This can be problematic in multi-animal environments like rescues and animal shelters. Ringworm is commonly spread by direct contact with other species or direct contact with an object that is infected. This can include beds, combs, food bowls, and carpet. Fungal spores can live in the environment for up to 18 months, which can make it difficult to get rid of.
The amount of contamination an animal receives can play a role in whether or not they become infected. Just because an animal is exposed to ringworm doesn't necessarily mean that they will get it. Healthy, adult animals are usually resistant to these type of infections unless they have open wounds on their skin. It is also important to note that just because an animal may be experiencing symptoms of ringworm, like hair loss, changes in coat appearance, or inflammation of the skin, there could be other underlying causes such as Cushing's disease, hypothyroidism, or allergies. If you suspect any symptoms, whether ringworm or not, it is always important to seek out a veterinarian's opinion.
With that being said, relying on symptoms is not the most accurate way of diagnosing ringworm. First, we can do a Witz lamp test. Like it was said earlier, this only works for about 50% of the cases. If a patient is positive for Microsporum canis, their hair and lesions will fluoresce greenish-yellow under the light. However, a patient can still be positive for Microsporum canis and not fluoresce under the Witz lamp, so it is important to not only use this tool as a diagnostic. If you're still uncertain that a patient has ringworm, the best test that can be done is called DTM. This stands for Dermatophyte Test Medium. DTM is a fungal culture which is used to isolate and identify dermatophyte organisms. The plate is made with special ingredients that inhibit bacterial growth, but allows the fungus to grow. To get a sample, hair should be plucked with sterile forceps around the concerning lesion or lesions. As sterilely as possible, the hair should be placed into the medium. For a more rapid fungal growth, you can wait for the culture plates to get to room temperature before placing the sample. With animals that are subclinical or are resolving infections, you can take a new toothbrush and comb the pet's fur and place the collected sample onto the dish. It's important to store the culture in a dark, warm, humid area and look at it daily for 2 to 3 weeks. Usually these plates are a yellow color to begin with and turn red if there is a presence of dermatophytes. If positive, the growth of the fungus will be white to cream color and fuzzy. After the growth appears, You can take a sample of it with a piece of sticky tape and place it carefully on a slide and add stain. The fungus can be seen on 10x objective, and at this point you can figure out which type of ringworm the patient has. This can be helpful in identifying if the patient got it from another animal with Microsporum canis or was transmitted via the environment, which would suggest Microsporum gypsum or Trichophyton mentagrophytes. After confirmed diagnosis, you can begin treatment. There are many different options available. The most common type of therapy includes topical, which can be creams, shampoos, or ointments. A common cream would be clotrimazole, and sulfur dips can be done twice weekly to help kill the fungus. Along with topical therapy, many times we will do oral antifungal medications, which includes ketoconazole and fluconazole. At this time, it's important to make sure that you try and disinfect the environment that you and your pet are around, and wash your hands after handling infected animals. Cleaning areas with 1 to 10 bleach dilution and frequent vacuuming and mopping will decrease contamination. If you live in a household with multiple pets, it might be advised to keep them separated until the animal is no longer contagious, or to treat all animals at the same time.
Treatment can last up to 6 weeks. Cultures should be taken periodically to make sure that the treatment is working. Typically, 2 consecutive negative ringworm cultures means that your pet has been treated appropriately and treatment can discontinue. With that being said, ringworm is very easily contracted, but it can be easily cured as well. It may take some time to control and stop infection, but mortality rate is low. However, the morbidity rate can be high. Pets may become reinfected if treatment was stopped too early or a patient is immunocompromised. It can be a very frustrating process to go through, but with the proper knowledge and care, it can hopefully be prevented.
Ringworm is zoonotic, which means that the fungus can be spread from infected animals to humans. This means that using proper personal protective equipment, or PPE, is extremely important. When you suspect that an animal may have ringworm, you should avoid any unnecessary contact, use gloves and a gown, and try not to let the animal touch your bare skin. Proper hand washing can help to limit exposure to ringworm in the clinic. It is also imperative that you disinfect any part of the hospital the potentially infected animal has come into contact with, so as not to infect any animals that come into the clinic afterwards.
Additionally, like noted earlier, we mentioned that other animals are susceptible to ringworm as well. I'm going to touch quickly on horses, as many people work with them as well. The most common type of ringworm seen in horses is called Trichophyton equinum. This fungal infection is just as contagious as small animal and can take time to heal. You cannot see this species under a woods lamp, and horses must be in isolation from other animals as well. Treatment includes clipping the infected hair to help lessen the contamination, as ringworm eats at the keratin layer of the fur and skin. A shampoo called Equiderma sulfate-free shampoo and then an Equiderma skin lotion should be applied daily to the infected areas for a couple of weeks. If left untreated, horses as well as small animals can self-cure within 6 to 12 weeks. But at this time, the patient is still contagious and actively shedding spores.
If you see your dog looking like this, you should get them to your vet immediately. They may have Microsporum canis, which could glow under the woods lamp. In order to test for ringworm, you turn off the lights in a room and use the black lights of a woods lamp to see if you can get the lesions to glow green. This happens only 50 to 60% of the time, but if it does, you have a confirmed case of Microsporum canis.
Oh wow, he has a really bad case. I wonder why.
It's probably because he's a puppy, and puppies and kittens are more susceptible to Microsporum canis. It looks like Katie has similar circular lesions to our patient's. She wasn't wearing the proper PPE when handling them, and Microsporum canis is zoonotic. She should have been wearing gloves.